dialectical behavioral therapy is four skills, four major skills. You learn how to maintain relationships and how to set boundaries. So this is a part. And then you learn emotional regulation, which part of what we're going to talk about today. And then you learn about mindfulness and meditation techniques. And also you learn stress, the stress tolerance, which is how to manage stress. We finished this part and this part. Now we are working on emotion regulation, and next session I think we're going to be working on mindfulness. I'm recording these sessions, so I'm going to upload them after we finish this series. So if you miss any of them, you can go online and listen to these sessions. But again, the discussion and the patient feedback, I think, is more helpful than the information that I'm presenting, because we learn from each other more than we learn from professionals. So that's why I would suggest you still keep, even I put everything online, but still recommend that you attend this session, because what we discuss at the end. Okay, we are talking in this session about overwhelming emotions. I mean by overwhelming emotions, negative emotions like anger, fear, jealousy, like these negative emotion when it become overwhelming. So this exercise, you need to learn what are the red flags that indicate that you are starting to lose control and you are experiencing overwhelming emotions. So some people, for them, overwhelming emotion will come as feeling hot or flushed or heart racing or shortness of breath. For others, it will be tension in your arms, tension in your head, tension around your eyes, tension around the shoulder. Okay. For others, it will be like talking more rapidly or talking more loudly. So the volume of your voice tone and the speed of your voice and how you talk is also could be a red flag. Also, a strong need to win or a strong need to crush someone, or a strong feeling that you want to make others feel bad because you're feeling bad, so you want everyone else to feel bad. So these are red flags. Okay, again, heart racing, shortness of breath, tension, speak more rapidly or loudly, and feeling a strong need to win or crush someone. Okay, so this is the first step, is to identify these red flags. Second is to, when you notice these red flags, this means you are gonna have now overwhelming emotion. You need to have a plan already learned, or some technique that you know and practice before. For some people, you know, and we learned this already in stress tolerance. Some people, to relax, you need breathing exercise. Basically, close your eyes and breathe in, breathe out slowly. That's it. There is hundreds of techniques for breathing exercise, but again, the main idea: close your eyes, breathe in, breathe out slowly. Some people will use counting, like counting from 100 backward: 100, 99, 98, 97, 96, and so on until you get to 1. By the time you get to 1, your feeling will become less overwhelming. Also, mindfulness techniques is that we're going to learn in the next session, lots of them. I'm not sure, not next session or the session after. Also, another thing is remember some of the past positive experience. Like if you feel overwhelming emotion, okay, imagine that you are in Mexico because you like this place, or imagine or try to remember your wedding day, or you try to remember your graduation day, like some positive experience in the past, and live in it. Some people will imagine that they talk to someone they admire or someone they like. So some people, to relax, they imagine that they talk to Jesus Christ, or they talk to their best friend, or they talk to their partner, or something like that. And there's lots of techniques that you can find. For some people, to leave the place. Like if you have overwhelming emotion of anger and you're gonna snap at people now and they maybe you're gonna react physically, yeah, it's better to leave the place. So some of the techniques is just leaving. So there is lots of them, and it comes with trial and error. So our first exercise is to create a list of the red flags that indicate you're gonna have overwhelming emotions. Also create a list of some healthy skills to cope with these feelings. Okay, this is our exercise one. Okay, another thing you need to learn is observing yourself without judging yourself. Okay, this is one of the Buddhist techniques, is accepting yourself without judgment. Okay, you still can work on it, changing destructive behavior and changing lots of the weaknesses you struggle with and the addictive behaviors, but do not hate yourself or be upset toward yourself or be angry at yourself or mad at yourself, because having negative feeling toward yourself will not help you to change. I think I told you before, the famous psychologist, his name is, I think, Carl Rogers. He once said, I wasn't able to change myself until I accepted myself. So it looks like dialectical, you know. You need to accept yourself first before changing yourself. It's fine to admit your past errors and the negative behaviors, but at the same time, you still are a good, kind, loving person, but you have some, you know, weaknesses that you need to work on. Okay. Another exercise is to identify trigger thoughts. In CBT, we call them automatic thoughts. Doesn't matter, you know, at the end, how we work in psychotherapy is by changing thoughts, feeling, and behavior. So there are something called the trigger thoughts. We mean negative thoughts. For example, Peter, he lost his watch, and then the first thought that come to his mind is, I am so absent-minded, I am an idiot, I am a failure. Okay. And he started to dwell on these thoughts. Of course, if you dwell on this belief, I am an idiot, I am a failure, you know, it's going to make you feel worse. But to let go of these trigger thoughts, it's better to use a coping thoughts or a healthy one, like mistakes happen, nobody's perfect, stuff like that. So our exercise is, I want you to identify what are your trigger thoughts. Okay, when you feel upset or angry or sad or depressed or worried or anxious, usually there are some trigger thoughts, which is negative thoughts, which is irrational thoughts, which is automatic thoughts. It is all different names for the same thing. And I give you here a list of most common trigger thoughts that people make people feel angry and experience overwhelming emotions. You know, one of them, I'm an idiot, I can't do anything right, I'm a failure, I'm incompetent, I'm unlovable, I am broken, no one care about me, everyone always leave me, I don't deserve to be loved, I can't make it in life without the help of someone, I am going to be alone forever, I can't trust anyone, and so on. You know, you will see the main theme around this is negativity and negative core beliefs. So this exercise is it's easy. Identify your own trigger thoughts that you tell me, oh, I don't know which one comes to my mind. You know, just recall a negative experience in the past, yesterday, 1 week ago. How did you feel? Angry, stressed, depressed, anxious? What was the trigger thought behind this feeling? Okay, and as Peter, you know, this guy, he replaced his negative thought with more a positive thought. So also exercise number 3 is you need to learn how to use the coping thoughts, positive ones. Okay, and then I give you a list here. You need to remind yourself of your strengths, your past success, and the truth. I don't want irrational thought. Yeah, to be too positive, like to be too positive is not good. You know, I just want you to be reasonable, like logic, rational. You know, uh, so if we have a cup, we have half empty, half full. I want you to see both. You know, but I don't want you to just see one thing. Um, so here are some positive thoughts. Mistakes happen. Nobody's perfect. This situation won't last forever. You know, I always say this one, this too shall pass. It might pass like a kidney stone, but it will pass. You know, I can be anxious and still deal with this situation. This is a learning opportunity. Personally, every time I experience like something negative, I use this one. Like, this is a learning opportunity and I learn from it. When I lose money, I tell yourself, okay, I'm learning from this opportunity. When I get sick, I learn from this opportunity. Like, this is, it become for me like almost automatic thought. Um, so you will find something with this will resonate with you. Choose one that work for you. Okay. Another one, you know, I can take all the time I need right now to get to let go and relax. I have survived the other situation like this before, and I will survive this one too. Sometimes I use this one too. Like, I remind myself of things that I survived in the past, and how I was able to overcome. It gives me a push. I'm strong and I can deal with this. So again, this exercise is, so we can go back. Exercise number 2, you're going to identify the negative ones. Okay. Exercise number 3 is you're going to identify the positive ones. Okay. Exercise number 4. So this is something you practice. Is not today, like it's not something we're going to do in the discussion, but something that I want you to practice at home. Is thought and emotion diffusion, or people call it meditation too. Like, when you have a negative feeling, you know, you close your eyes and imagine that you are sitting in a field or something, and you imagine that you have, you know, there is a train in front of you. There is a train, and imagine that you are taking all your negative feeling and put it in the train. And then the train is passing by, and then you put more in the train as the other cart, and then you put more, and then you put more. Then you take all the resentment and put it in the train. Some people like this idea of imagining that there is a train in front of them. We use visualization to put to make the feeling are more like physical stuff, and we put it into the train. You can imagine also the cloud, like close your eyes and imagine there is cloud that is floating away, and you are putting your feeling into the cloud. And you imagine that the clouds are floating away or going away. Some people will imagine that they are sitting on a river, okay, like near a stream of water, and there is leaves passing by or floating, and then you put your feeling into on these leaves, and the water is taking them away. Doesn't matter. It just the idea is you imagine that the feeling is coming outside yourself and going away. This is the idea. And again, the lady, the psychologist who developed these, the dialectical behavioral therapy, she got these ideas from Buddhism, because this is a Buddhist meditation. So this is something we will not practice here during the exercise, but at home, because people tell me, oh yeah, I can do the cognitive reconstruction, like change of negative thoughts to positive thoughts, but still the feeling is here. Like I feel like, you know, heaviness in my chest. I feel like something choking here. Like I feel like headache. Like I feel it in my body. So the visualization will help you with letting go of the feeling. Anyway, I finished my talk. We have today 5 exercises. Okay, one of them you're gonna do at home, the practice, the meditation or the thought or emotion diffusion. Okay, the other 4 exercises. I want you to choose 2 of them that you're going to do, or 3 if you want. The first exercise is you make a list of your red flag feeling or behavior. I told you the tension, the feeling flushed, feeling the need to win or to crush someone. All these are red flags for overwhelming emotion. And I want you to make a list of healthy coping skills: meditation, exercise, imagination, listening to music. It doesn't matter, whatever skill that work for you, it is good. Exercise 2 is identify trigger thoughts. Exercise 3, the trigger thoughts are the negative ones. Exercise 3, identify the coping thoughts, the positive one. Like I told you, this too shall pass. I use it. Which one I use all the time? Yeah, this is a learning opportunity. I use it. I'm talking personally. Like the third one I use also, like I survived a lot, and yeah, this too shall pass. So you identify your own coping thoughts. Exercise number 5, based on Heather presentation, is what are your love languages? Do you like the physical touch, or do you like the act of services, or do you like words of affirmation, or you like quality time, or you like gifts? So tell us which one you like, and if you don't want to talk about yourself, you want to talk about your partner, tell us also about your partner.